Welcome to the deep dive. Today we're going to be looking at something that might seem a little out of place for dentistry. We're going to be talking about ARDS, or Acute Respiratory Distress Syndrome. By the end of this deep dive, I hope you feel a lot more ARDS informed, especially, thinking about it in the context of your dental practice. Now, I know what you're thinking. Why ARDS? Why are we even talking about ARDS? Is that something that you deal with in an intensive care unit?
You're absolutely right. It is primarily an ICU concern. But, the thing is, dentists need to be aware of it too, because there are certain situations in a dental setting that could potentially lead to complications, things like aspiration or allergic reactions. These things can actually trigger ARDS.
Okay, so that makes sense. But before we get into the nitty-gritty, can we just back up for a sec? Can you just break down ARDS in the simple terms for me? Like, what exactly is it? I mean, the name sounds pretty intense.
It is. It is a serious condition. But let's simplify it. Just imagine your lungs can't do their job. They can't deliver oxygen to your body. They can't remove carbon dioxide.
Yeah.
That's basically the core of ARDS. It's a life-threatening condition where your lungs are failing.
So if the lungs can't deliver oxygen, that affects the whole body. Right?
Exactly, the domino effect. When your organs don't get enough oxygen, things start to go wrong everywhere. And that's why recognizing ARDS early on is so crucial.
So how do we as dentists
Yeah.
even suspect something like ARDS? I mean, we're not lung specialists, right?
Right. You're not diagnosing it, but you need to be aware of the warning signs. The gold standard for diagnosis is something called the Berlin definition, which might sound complicated, but it boils down to a few key things. Rapid breathing, low oxygen levels in the blood, and you'll hear these specific crackling sounds when you're listening to the lungs with a stethoscope. And importantly, these symptoms usually appear pretty quickly within a week of some triggering event, like surgery, an infection, or trauma.
So let's say you've just finished a procedure and you notice your patient is breathing really fast. Their oxygen levels are dropping. And you hear those crackling sounds. That's when alarm bells should be going off.
Absolutely. At that point, you need to act fast. But to really differentiate ARDS from other lung problems, we need to look a little deeper. And that's where imaging comes in.
Ah, yes, the X-ray. Those are pretty standard in dentistry anyway. So are X-rays helpful for spotting ARDS?
Absolutely. A chest X-ray is usually the first step. Think of it like this. If ARDS is present, the X-ray will show what we call bilateral diffuse pulmonary infiltrates. Basically, that just means widespread white patches in both lungs. And that's the fluid buildup that's characteristic of ARDS. Now, in some cases, a CT scan might be needed to get a more detailed look, especially if we suspect the cause might be outside the lungs, something like sepsis, for example.
So we're gathering clues from the patient's history, we're seeing their symptoms, and then the X-ray starts to paint a clearer picture. What about blood tests? Can those tell us for sure if it's ARDS?
Well, unfortunately, there's no single blood test that screams ARDS. But blood work can help rule out other conditions and give us clues about what might be causing it. For instance, blood tests can detect infections. They can measure inflammation levels and assess how well other organs are functioning. It's all about putting the pieces of the puzzle together.
I see. So we're using all these tools to figure out what's going on. Now, I've heard of something called pseudo-ARDS. Is that something dentists should be aware of?
Definitely. Pseudo-ARDS is also known as atelectasis, and it can sometimes look like ARDS, especially after a procedure where the lungs haven't fully reinflated. It's basically where the tiny air sacs in the lungs collapse temporarily. It's important to distinguish this from true ARDS because the management is different.
That makes sense.
Mhm.
So let's say we've done all our detective work and we strongly suspect ARDS. What happens next?
Well, that's when we shift gears from diagnosis to management. And ARDS management is multifaceted. It's about tackling the root cause and supporting the lungs while they recover.
Okay, so treat the underlying problem first, whether it's an infection or something else. But what about supporting the lungs? What does that involve?
Well, fluid management is key. We want to prevent fluid from building up in the lungs while also making sure there's enough blood flow to the rest of the body. It's a delicate balancing act, kind of like watering a plant too much and it drowns too little and it wilts.
Okay, so it's about finding that sweet spot. What other tools are in the toolbox for managing ARDS?
Well, there's always a debate about steroids. They can be helpful for reducing inflammation, but their use in ARDS can be tricky. It really depends on the specific cause and has to be decided on a case-by-case basis.
Got it. So it's a tailored approach. Now, I know that in severe cases, patients might need help breathing. Can you tell me about ventilator support?
You're right. For milder cases, non-invasive options like a high-flow nasal cannula might be enough. But for more severe cases, mechanical ventilation becomes crucial. And the key here is early intervention. Waiting too long can put too much strain on the lungs and make recovery even harder.
I'm curious, what makes this mechanical ventilation so special? How does it actually help the lungs?
Think of it like gently inflating a balloon. You don't want to overstretch it, right? Well, mechanical ventilation in ARDS is all about being gentle on the lungs. We use lower air pressures and smaller breath volumes to avoid overinflating them and causing more damage. It's called lung protective ventilation.
So it's not just about getting air in good. It's about doing it in a way that protects the lungs. That must involve a lot of careful monitoring and adjustments, right?
Absolutely. It's a team effort, often involving respiratory therapists, anesthesiologists, and other specialists. And speaking of interesting techniques, there's also something called proning.
Proning. Is that like turning the patient out of their stomach?
Exactly. It might seem simple, but changing a patient's position from lying on their back to lying on their stomach can significantly improve oxygen levels.
Wow. I would never guessed that something so simple could have such an impact.
It is pretty remarkable, isn't it? While it used to be seen as a last resort, studies are showing that starting proning early on can be really beneficial. And then we have more advanced ventilation modes like APRV and bi-level, which can be used in more complex situations, but we can dive into those a bit later.
Okay. So we've covered the basics of recognizing ARDS and some of the initial management strategies. But where do we as dentists fit into this bigger picture? We're not managing ventilators and proning patients in our offices, are we?
No, of course not. But your role in recognizing the early signs and knowing what to do next is crucial. It's like being the first responder in a critical situation. You might not be the one performing surgery, but your quick actions can save a life.
That makes me feel like I have a much bigger responsibility than just fixing teeth.
You do.
Yeah.
And we'll talk more about how to handle those critical situations in part two. But for now, just remember, early recognition is key, and knowing the basics of ARDS can make all the difference in patient care.
This has been fascinating so far. I'm already feeling more confident and prepared. I can't wait to learn more in the next part.
See you then. Welcome back to our deep dive into ARDs.
You know, we've covered a lot of ground already,
Yeah.
but I'm still trying to wrap my head around how all of this connects back to dentistry. It's not like we're running intensive care units in our practices.
True, you're not managing full-blown ARDs in a dental chair. But that's exactly why this deep dive is so important. Understanding the triggers and early signs of ARDS in a dental setting, that can truly be life-saving.
Okay, I'm all ears. Give me a real-world scenario.
Okay. Let's say you're performing a routine extraction, and for whatever reason, the patient aspirates some tooth fragments or some blood. This could lead to aspiration pneumonia, which we know is a trigger for ARDS.
Ah, I see. So something that might seem like a minor complication during a dental procedure can actually snowball into something far more serious.
Exactly. Or imagine a patient with a history of severe allergies comes in for a procedure, and they have an anaphylactic reaction to a medication. Well, that could also set off ARDS.
Okay, those are some pretty vivid examples. But what can we as dentists actually do about it? We're not equipped to manage ARDS in our offices.
Of course not. But what you can do is be incredibly vigilant. Know your patient's medical histories inside and out, be prepared for any potential complications, and most importantly, act swiftly if you notice any of those red flags we talked about earlier.
Right. Early recognition is key. So let's say we suspect ARDS. What's our next move?
First and foremost, basic life support. Make sure they have a patent airway administer supplemental oxygen and monitor their vital signs closely. You want to stabilize the patient while you're calling for help.
Got it. Stabilize and call for backup.
Exactly. Time is of the essence. And while you're waiting for EMS to arrive, gather as much information as you can. What procedure were you performing? Did anything unusual happen? Does the patient have any known allergies or medical conditions? All of this information will be incredibly valuable to the paramedics and the emergency room team.
So we're the first line of defense, but we're also a critical link in the chain of care. It sounds like our actions can really have a ripple effect on the patient's outcome.
That's a powerful way to put it, and it really underscores just how important it is for dentists to stay informed about ARDs. Even though the management is outside of your scope of practice, knowing the basics empowers you to act decisively and potentially save a life.
It's all about connecting the dots, isn't it? Understanding how something we do in dentistry can be linked to a serious condition like ARDS, even if it seems unrelated at first.
What's fascinating is how much dentistry has evolved beyond just teeth. We're becoming more and more aware of all the intricate ways oral health connects to overall well-being.
It's like that saying, the mouth is the window to the body. We're not just treating teeth anymore. We're playing a vital role in safeguarding our patients' overall health.
And that brings us right back to our initial point. Even though ARDS is primarily an ICU concern, it's something that can have implications for the dental chair. Your awareness and preparedness can make all the difference.
Speaking of connections, I'm curious, are there any specific dental procedures that might carry a higher risk of triggering ARDS? We talked about extractions and allergies. What else should we be thinking about?
Those are definitely high on the list. But there are others worth mentioning too. Any procedure that requires intubation for general anesthesia, for example, that carries a risk of aspiration, which, as we discussed, can lead to ARDS.
Right, and I imagine any procedure involving significant bleeding could also increase that risk of aspiration as well.
Precisely. And we can't forget about infections. A seemingly minor dental abscess, if left untreated, can develop into sepsis, which is another potential trigger for ARDS.
Okay, that's pretty sobering. It really highlights how important meticulous infection control is and how crucial it is to treat any dental infection promptly.
Absolutely. And it all comes back to the interconnectedness of oral health and overall well-being. What happens in the mouth doesn't stay in the mouth.
This also makes me think about immunocompromised patients. They're already more susceptible to infections, so I'd imagine their risk of developing ARDS would be higher as well.
You're absolutely right. Managing immunocompromised patients requires an extra layer of vigilance. You need to be even more meticulous about infection control. And, consider prophylactic antibiotics when appropriate.
It's like we're walking this tightrope, balancing the need for treatment with the potential risks. But by understanding these nuances, we can make informed decisions that prioritize patient safety above all else.
It all comes down to careful risk assessment and individualized care. Each patient is unique. And their medical history, their current health status, the specifics of the procedure, all of these things factor into the equation.
I'm starting to see ARDS not as this distant, abstract concept, but as a very real possibility that we need to be prepared for in our practices. And that preparedness comes from knowledge.
Exactly. Knowledge is power. And in this case, it can be life-saving.
This deep dive has been like a crash course in ARDS awareness for dentists. We've gone from what is ARD to how can we prevent and manage its potential triggers in a dental setting.
And that's just the tip of the iceberg. There's so much more to explore.
Well, I'm ready for more. What other fascinating insights do you have in store for us in part 3?
We'll delve deeper into the specific steps dentists can take to mitigate the risk of ARDs. We'll cover everything from preoperative assessments to postoperative care.
Sounds like a plan. I can't wait to learn more. See you in part 3. Welcome back to the deep dive. We're wrapping up our exploration of ARDs and how this critical care concept kind of intersects with the world of dentistry. It's been a journey, but I feel like we've covered so much ground already.
It has been quite a journey. We've gone from demystifying ARDs to understanding its relevance in a dental setting. And now, we're going to equip you with some practical strategies to minimize the risk of encountering this condition in your practice.
Okay, let's get practical. What concrete steps can we take as dentists to minimize that risk of ARDS in our practices? I'm ready to put all this knowledge into action.
It all starts with a thorough preoperative assessment. Think of this as your first line of defense.
Can you break that down a little bit? Like, what exactly are we assessing?
It's all about gathering as much information as you can about the patient's medical history. Do they have any respiratory conditions, like asthma or COPD? Have they had any recent surgeries or infections? Are they on any medications that might increase their risk of bleeding or aspiration? You want to be aware of anything that could potentially complicate the procedure.
So we're kind of piecing together clues that might point to a higher risk of ARDS.
Precisely. And don't underestimate the power of just asking the patient direct questions, Do you have any concerns about your breathing? Or have you ever experienced any difficulties with anesthesia in the past? Sometimes the most valuable insights come directly from the patient.
That makes sense. It's about open communication and making sure the patient feels comfortable sharing any concerns that they might have.
Exactly. And based on that initial assessment, you can tailor your approach to minimize risk. For instance, if a patient has a history of aspiration, you might choose a different type of anesthesia or adjust their positioning during the procedure. It's all about customizing your approach based on each patient's unique needs and risk factors.
I see. It's about recognizing that one size doesn't fit all. Each patient needs to be evaluated individually.
Absolutely. And this kind of leads into the importance of informed consent. You need to make sure your patients understand the potential risks and benefits of any procedure, especially if they have any underlying health conditions.
That's a good point. We need to be transparent and make sure our patients are fully informed before we proceed with any treatment.
Transparency is key. It empowers patients to actively participate in their own care.
So we've covered preoperative assessments. What about during the procedure itself? Are there any specific techniques or precautions we can take to minimize the risk of complications that could lead to ARDS?
Meticulous attention to detail is crucial during the procedure. If you're using general anesthesia, proper intubation techniques are paramount to prevent aspiration.
And I imagine suctioning plays a big role in minimizing the risk of blood or other fluids entering the airway.
You're exactly right. And of course, maintaining a sterile field is essential, especially if there's any risk of infection.
So it really comes down to good old-fashioned fundamental clinical skills.
It does, but it's not just about technical proficiency. It's about maintaining a heightened awareness throughout the entire procedure.
Being present in the moment, being vigilant, being ready to adapt if the situation changes.
Precisely, and this vigilance extends into the post-operative period as well.
Okay, so the procedure's done. What are our top priorities in post-op?
Monitoring. You want to make sure the patient is recovering well, their breathing is stable, and their vital signs are within normal limits.
And I imagine clear post-operative instructions are essential.
Absolutely. Patients need to know what to expect during recovery, what signs to watch out for, and when to seek medical attention. Don't assume they know. Educate them.
So we're empowering them to kind of take an active role in their recovery as well.
Exactly. And by following these steps, thorough preoperative assessments, meticulous intraoperative techniques, and vigilant postoperative monitoring, you can really dramatically reduce the risk of ARDS in a dental setting.
It's about being proactive, not reactive. Understanding the potential risks, taking precautions, and acting swiftly if any red flags pop up.
It's a shift in mindset. You're not just treating teeth, you're safeguarding your patient's overall well-being.
This deep dive has honestly been a game changer for me. It's really broadened my understanding of the connection between dentistry and critical care, and it's given me the knowledge I need to provide even safer and more informed care.
It's been a pleasure sharing this journey with you and our listeners.
And that brings us to the end of another deep dive. We hope you found this exploration of ARDS insightful and empowering. Remember, knowledge is power, and by staying informed, we can all make a difference in our patients' lives.
Until next time, keep diving deep.